Hello all, good afternoon and welcome to our latest edition of Practo Connect. My name is Dr. Nilesh Bhandari and today we will talk about how technology is transforming healthcare. The way patients access and expect healthcare has changed over the last few years and especially in the past year and a half. It includes the use of digital tools to improve prevention, diagnosis, treatment, monitoring, management of health and lifestyle. The future of healthcare is shaping up in front of our very own eyes with advances in digital healthcare technologies like artificial intelligence, virtual and augmented reality, 3D printing, robotics, nanotechnology, and many others. We have to familiarize ourselves with the latest developments in order to be able to control technology and not the other way around. To speak on this complex but interesting topic and guide us through this maze, we have with us the very esteemed speaker, author, policymaker, and last but not the least, a very dear friend, Professor Rajendra Pratap Gupta. Professor Gupta is a leading public policy expert with vast experience in policy making. He has been involved in many global path-breaking initiatives and organizations working on digital health and holds several key positions in the digital health arena. He is a member of the Guidelines Development Group Digital Health and on the global roster of experts in digital health at the WHO. He is the board member of the International Society for Telemedicine and E-Health. He is the member of many UN organizations and WHO organization committees. He's also the former advisor to the Health Minister of India. He's also the author of a path-breaking book called Digital Health, Truly Transformational, which I believe should be a must-have companion for all doctors who want to venture into the path of digital health. Towards the end of this particular webinar, we'll also be sharing the link to check out this book and a special discount code for all attendees. Over to you, Dr. Gupta, please.
Thank you, Nilesh. Thank you, Practo. Thank you, Walter Kluvers. Thank you, Rajesh. And my dear friend, Shashank, the visionary founder of Practo. I think it's a great opportunity to interact with our fellow friends from the medical community. It couldn't have been a better time, and the way I have structured this talk, as requested, Nilesh, by you, is a presentation followed by a discussion, because I think any such interaction without worthwhile discussion, doesn't lead to a change of ideas. This is what the goal is. I think one of the key things that I see, which I am going to talk about, is the entire ecosystem is changing. I think that is what every clinician should understand today. And when I say ecosystem, I mean the definition, the direction of what a clinician is, what a diagnosis is, what a treatment is, what a follow-up is, and what the procedure is, what a drug is. In fact, it is such a big change that technology itself is becoming a treatment. So I think it's going to be an exciting talk. The way I've structured is, I'm going to talk about what are the key drivers for this change. What's driving globally, how it's going to impact us, what's coming from within the country, and what are we experiencing thanks to COVID. Not something we should be thankful about, but at least something that has come is that we are able to connect with so many people across the country online, which rarely happened before 2020. Firstly, we owe a big thanks to our friends from this community who have stood by us, made sacrifices, taken risks to keep us going. I think we wouldn't have passed this time without you being around. So many of you have been helping us 24/7. So a big thank you to you. So what I'm going to do next is talk to you about what's shaping up. One of the things that I think every clinician needs to realize is the entire ecosystem is changing. Now, the call that you have to take is, should I be a part of the ecosystem and be a part of the change, or should I be lost out? We all know that, if the entire ecosystem is changing and if you don't want to be a part of it, you'd stay away for long, you'll be dropped out. You cannot afford. I cannot afford. I think all of us need to ensure that we start talking about the transition to digital health now. That's, I think, the biggest opportunity. Also, digital health is not about using fancy gadgets. It's not having a 5G phone or having the latest software or a gadget. It's actually a mindset. It's a mindset where you keep looking at the future and say, hey, look, this is the future of my practice. I'll give you an example. And I ask every clinician on this talk is, if you Google your specialty and ask one question, what is the future of my specialty? Like future of pediatrics, future of oncology, future of orthopedics. and look at the results that come out. And you will find that the maximum results will come out is about technology driven care. That is how the practice is transforming. And this is not because you and I need it. It is about the needs of time. It's about the demands of the care seekers. I think our care seekers are also expecting more from what we do now. So it's time for us to also look at what are the big changes. We all know Apple as a company for iPad, for Macs, for iPhones, for iPhones. But you know what the CEO said in 2019? It's very interesting to watch this.
If you zoom out into the future and you look back and you ask the question, what was Apple's greatest contribution to mankind? It will be about health.
So just think about it. If a company like Apple is saying that we wish to be known for health, and they are venturing, they are in it, then you can understand that can you or I be left untouched? That's the question we need to ask ourselves. But that doesn't stop at Apple. I think I'm going to talk about all the top $4 trillion tech companies and what do they think about health. So this is what Google thinks, that AI will transform healthcare. Not very surprising. When I looked at the studies, and I mentioned that in the book, that the doctor's role will also evolve with AI, and 70% of the doctors felt excited about it. So nothing to worry. We need to understand it. We need to also imbibe it in our practice and move with it. Let's look at what Satya Nadella said. So he says healthcare should be an AI first industry, and it could change the way healthcare is given. Just look at the way people are looking at health and prioritizing it. So there's no question of us still waiting to see what will happen. This is something that we all know, and this is what Amazon was advertising in India. I actually picked up during one of the time when I was browsing LinkedIn. So Amazon Web Services AI, they say better predictions, healthier lives. So look at the next one. So 3 major companies, Amazon.com, Berkshire Hathaway, and JP Morgan Chase come together and they form a partnership for health insurance. Well, at the top of it looks like a partnership. This company is called Heaven. Each of these 4 companies, and look at even Johnson acquiring a company in digital surgery space. So clearly, there's big tech companies, and the big companies are not doing this for smaller things. And India is a big country, 138 crore people. So I think all these companies have the wherewithal. They also have the clout and influence that they can, get into it and just pull the carpet. That's it. Let's be prepared about it. There's nothing to worry. I think technology gives us phenomenal opportunity. We need to understand is that Nilesh said, and we need to ride that wave. Let's look at the journey, how it started. So I've been into it for close to quarter of a century. So a lot of enthusiasts, before me even, talked about digital health. In fact, today on my Facebook, it showed up that this day, a decade ago, I was in Cape Town at the GSMA summit. It's a big summit worldwide on technology driven care. And I remember people saying it's a gimmick. It won't last. And I believed it was not a gimmick. It is here to stay. It's here to transform. In fact, I used to say that healthcare will converge to mobile. And I think today all of us stand to see that. So when we started talking early on, later big tech jumped in. So as I talked to you about those $4 trillion companies, they all have jumped into health and they have made it the high priority. But what happened with COVID is it fast tracked it. So digital health time is now. That's where I think journey has been fast tracked since last year. How has the evolution been? Now, this is an interesting story and I've been writing publicly about it. So a very interesting thing when I reflect back is that almost like 6 years, more than 6 years ago, I wrote this software as a drug. Some people kind of, panicked it because it came on ET Health World, which is prominently read. And I said, this is the change where we talked about software as a service, software as a product, and now software as a drug. But you'll be surprised that our friend's company in the US, who is an Indian, was the first company to have software as a drug, which is reimbursed by insurance companies like a drug. That's the change that happened 6 years ago. And it's not that, it has stopped at that. 5 years later, I wrote this. I was invited by the Prime Minister's Office of Bangladesh to help them draft their AI and big data policy. Now, while I was looking at it, I realized that all of us, sit on heaps of data. Every clinician sits on data of his patients. But just understand what data is. Data is the identity of a patient. Data is also the diagnosis. Data is also a health coach. I mean, I'll talk in the subsequent slides about each one of them. Data is also a drug, and it's also a treatment. Isn't this surprising? We call big data, and we just started thinking, what would data mean? But data is all this and more. So we need to understand what we are doing with the data that we have. Are we really having the data in the form that we should have? That's another question. COVID revealed many things. I think all of us has passed through this painful time. We are still passing through it. We're still living under the fear. But it's so led to a revolution. I led a 127 nation study, which is mentioned in the book. So I have taken the excerpts from the book, and these were glaring findings. So this study was done between April and June 2020. And 83% people said we are comfortable using technology. And if you take the 3% off, which is saying we are not comfortable, if you add fence sitters, you have 97% people saying, hooray, we need technology. That's where we are. Look at this. So when people have to seek health information, their obvious choice, pick the phone, search online. So you have to be where your patients are. Today they are online. And all these are primary study that I have led, so I vouch for them. And this is where we are also seeing the transition that's happening. So if there is a health related information, again, back to asking the information, visit to a hospital. If they were given a couple of choices, the first choice would be again web. So I think these are clear indicators of the direction where healthcare is headed. So when we looked at what's the future of health, where do you see the future? Do you think technology will impact? 3 out of 4 people said certainly it will. That's the reality. If you look at clinicians and what do they feel, what they have done in the past 6 months, we are talking at the peak of COVID, almost when it started plateauing in the first wave. This is their response. So if you look at 72% of the clinicians had actually used it. That's where the big massive shift happened. So if you look at pre-COVID situation, it was 10% people who were using it. And you look at during COVID, it went right up to 80%. That's a major shift. Is it going to last? I'm going to talk about that because we also checked that. So I led 2 studies on this. So there was another study that I did between 14th to 31st of October 2020, which was across 38 nations. So look at the future plans. The numbers have gone back, except the 20% say we'll go back to traditional practice. But as I said, ecosystem is changing. This 19% will have to relook as they look at the way healthcare is changing. And I'll walk you through what I mean when I say the ecosystem. So this is a shift that's going to last. It's not going to go away. Compare this, which is pre-COVID, which is like immediately prior to COVID, which is 6 months. During COVID, you can see the difference. The blue one is the digital consults. And after COVID, so you can very clearly see the direction now. That digital consults are here to stay. Maybe little marginal less than what they are at the peak of COVID, but certainly they are going to stay. And post-COVID, this is where the scenario is, and I think we should be ready. So what does digital health mean for you as a clinician? The first thing, I think everyone has to make an investment or to run a practice. So the evidence is mounting that says your return on investment increases. You have better control over your practice, which is management, and then you lead to better outcomes. The second is the patient engagement. Every clinician thrives to make sure that the patient is happy, satisfied, and treated well. So digital tools help you do that. Safety is a big concern post-COVID. I think that also gets addressed. The important part is that if you are a clinician, it gives you an edge. It gives you a differentiation. It also gives a choice and gives maybe an edge on the cost and more on compliance because you are digitized on your practice. Also, I looked at 4 different areas, where is the improvement. So diagnostic ability, your productivity, patient doctor communication, doctor communication. What it increases is patient safety, patient satisfaction, clinical outcomes, return on time, return on investment. What it reduces is the cost of care delivery. A patient doesn't have to travel to you all the time. It can be a hybrid consultation. Medication errors get reduced and adverse events. Saves physician time, and patient money, which is every clinician's thrust. So we're also looking at what does technology do to your practice. As I said, your patients are in the virtual world, so you need to be visible. So it's the visibility that the technology tools give you. How you connect to your patient, how you get to treatment, how do you follow up, how you do the post-treatment follow-up, knowledge updation for yourself, referral, and of course the CDS, which has become more and more popular with time. Let's look at the impact of internet. These are data for various specializations. So in this talk, I am going to also share with you the data for various specializations. I have tried to cover as much as possible given the limitations of time, but as I said, everything comes from the book, all data, everything, all the videos also come from the book. So the first thing is a very interesting point that 97% of the pregnant women search internet for information, but most importantly, 83% ended up changing their decisions based on the information that was available online. So for a gynecologist, this is a very important action point. I have a friend in Bombay who is a leading gynecologist. So he always sends a website to his patients before they come to his clinic. They say, read it, get most of your questions answered, or get more questions before you come to my clinic well informed. So I think the actions are quite out there. Also, let's not worry. Some people say, and this was a comment I heard last year. I was speaking at a major summit in UAE. So I recall the hospital CEOs were saying, we would not adopt digital health much because we fear that patients will not come to us. So our investments on hospital beds will go empty. But just imagine what happened in March. If you didn't have digital tools, how do you connect with the patient? It was just the reverse. So I think our perspective has also changed very quickly. We all think that, when patient gets access to net, they are not going to come to us. Actually not. The research is this. They say that patients always used to augment the information and not circumvent the health professionals. That's the research. So let's be very clear about it. We should get them access to what they need. Because I think given the doctor-patient ratio in India, it is tough to spend time with patients, given the number of patients you have. But I think one can use technology resources that they get the information, they come prepared. Also look at this data. Between 59 and 70% of the patients will look for surgical procedures and plastic surgeons online. I think that's where relevance of organizations like Practo, which have become the world's biggest platform for doctors. When I was researching this area, I figured out that it was a very proud moment for me when an Indian company operates in 20 countries, serves 200 million patients every year. It's fantastic, and it's become the world's biggest platform. Also, 1 out of 5 patients with a smartphone have at least one app on their phone. Now, what happens under social media? How people are getting influenced. Now, that's very interesting. People always dismiss that social media is like time pass, there is information with less credibility and all that stuff. But you'll be surprised. There is also a study that says, which is by clinicians, that says 60% clinicians believe that the quality of care delivered gets improved because of social media. So let's understand the side of the internet that's influencing social media and how. Here is this. So 4 out of 10 people get influenced by social media on the choice of their care provider. So as a clinician with a practice, as a healthcare provider, you need to take a conscious call where all you need to be. Also, patients prefer doctor who use email. Email is also comfortable for you because you don't have to reply at your own, the moment it comes. You can reply at a dedicated time. Someone can reply from your office. But this is one thing that decides whether I should go to a doctor, surprisingly. That's where the primary research says. Also, 4 out of 10 are influenced by social media and how they deal with their health. That's pretty amazing. social media has so much influence on our decisions related to health. And when I talk about specialties, you'll be surprised too. So when there is a disease or medical condition, Facebook is a significant source of information. I never thought so. We used it. I must say that I have been a beneficiary of social media, and some of you got connected thanks to social media posts on this webinar. But for health, yes, this is showing up. In fact, doctors, if you look at what they look at what their other fellows are posting on social media. It's a very insightful thing. So younger clinicians are actually moved totally to Instagram. They're looking at Instagram videos, the photographs on treatment. So this is the differentiation on the age group versus social media. The younger lot are on Instagram. So this is another specialty, and nephrologists actually use Twitter to share the links, the updates on CKD and other things. So these are the research driven facts that we should know. Now what I do is I'll talk about the specialties. I'll try to cover as many as possible. But let me tell you what I write here. I've gone into detail in the book for every specialty, every disease. I've tried to cover in the book about a specialty, what's going on around the world in digital health. What do you expect to happen in next 2 years? And what are the action items for you if you are a practicing clinician in that specialty? Of course, let's be very clear that digital consults, EMR, are a basic for everything. So let's talk about anesthesiology. A very interesting part is the hospital information system, AI and digital consults have been really beneficial to anesthesiologists. And how, let me tell you. So they help you to prioritize your time, your resources. And in the perioperative state, talking to the patients has actually been helpful to reduce anxieties and led to better outcomes. So the fields are all using, the technology. So most of these fields are getting to form their own guidelines, the way they interact with the patients using technology. Dermatology with dermoscope and teledermatology, 3D digital consults, this specialty is moved on much higher. I think during COVID, I have consulted a dermatologist for one of my family members, and we have seen the result, and it was related to a kid. And in fact, actually, and Mayo Clinic is using digital assistants like Alexa. So when someone does a dermatological procedure, Alexa answers the question, should I take a shower after the procedure? Is there a swelling? What do I do? So that's the level of advancement and usage of digital tools in this specialization. But it's a lot more than that. Digital cardiology. So when I picked up my Apple Watch 4 2 years ago, I was surprised at the quality of ECG that came out. So right from ECG to digital risk assessment to IoT driven pacemakers. So now you have pacemakers. Medtronic has that, where without the intervention, the sensors in the pacemaker transmit the readings and the details to the doctor. No intervention requires, no need for the patient to panic. But there are many more things happening in this field. So all specialties, if you look at, they're actually leveraging technology one by one. Digital dentistry is a very interesting field, and I'll relate to you what I saw 2 years ago in the Tumor Medicity, this in UAE. So when I was walking through, and their president, Dr. Moridin walked me through his Tumor Medicity in UAE. So he took me to this dentistry department. So what they do is they do 3D printing. So he was telling me, that now a patient doesn't need to come thrice, one for examination, then for giving the details, and third time for the procedure. So they do the dentistry entire procedure in the same sitting. In the same sitting, done, customized to that person, saving time, money, effort, and even infection. You don't have to come again and again. So earlier what happened, if you wanted an enamel shade, you took a film, you took a photograph, went it to printing in a lab, then went to figuring out the shade. Now what happens is, with the cameras that are available, what you do is you use those cameras, the intraoral cameras, image is transmitted directly to your computer, and it goes to the lab, and that's it. So I think all these specialities are actually changing, and they're practically being done. Digital endocrinology, I mean, I'm going to walk you through a video on this. But let me give you an example. In fact, maybe that doctor friend of mine may be watching this webinar. So I was not able to control my sugars, but I use my Bluetooth enabled glucose meter. So what I did is I mailed him my readings. It is 15 days ago. He went through them. We got a call. Based on my readings, his prescribed medication, and for the last fortnight, I am able to manage and bring down my sugar readings. I have not met him. It is just done through transmitting my sugar readings through my Bluetooth enabled glucose monitor. He's sending me a WhatsApp with the prescription, ordering the medications, getting it, and starting the treatment. But it's going much beyond that. I'll give you an example about how endocrinology is changing, but it's end-to-end management. And this is not just for endocrinology, any chronic disease. This realm is changing very fast. Family medicine. So this is a very interesting field where digital GP is now a reality. In fact, UK has formally rolled it out. And you'll be surprised that chatbots working with the physicians did better when compared to the doctors in the MRC GP exam. They scored 81% compared to 72% of the doctors. But I think this is an important field, with most of us wearing wearables which are tracking the key indicators. I think all of us need to understand the way things are. I have this finger ring which you see, which tracks most of my vitals, my heart rate, my sleep, my steps. All I need to do is look this up, and it is integrated to my other EHR, and I just send it to my doctor. That's it. So I think family medicine, the practice of the general physician, is also going to be much more pivotal and much more effective with the latest tools of technology. In fact, there are multiple tools, but in the interest of time, I'm just limiting it to saying digital GP with wearables. It's going to be a whole new preventive care model. Digital surgery. Actually, surgery is one of the earliest fields that started using robotics, I think way back in 1985, so almost 35 years ago. But now this is coming big with robotics, 3D simulation, with virtual reality. So Stanford uses virtual reality and 3D simulation to plan complex surgeries. And this is also coming down in our country, where people are started to looking at it. Now, Gerent technology, this is interesting. Mobile apps, holograms, virtual communities. Given that the senior citizens, which is our silver economy, is huge. We have almost like today close to 20 crore senior citizens, and they suffer from one ailment or the other. This is where the technology comes to the rescue. There are gadgets that report a fall, which happens often now, and there are technologies that can take care of the senior citizens' needs, linking up to their physicians, the home care services. So this is totally driven by sensors and technology. This is an area which is fast getting to adopt technology. Digital microbiology. Now, this is where I'll give you an example, like in the emergency and medicine, where you need tests quickly. It is reducing the time from 12 to 48 minutes, by 12 to 48 minutes, which is huge. And some of the tests, it is reducing the time from hours to minutes. Effectively, if you look at in the AMR space also, the antimicrobial antibiotic resistance, this is AI and ML has done wonders. And it has saved not only time, but it's actually far more accurate. Nephrology is another field where we have seen the use of technology. In fact, it has reduced readmission rates by 39% and brought down the failure rates of the treatment by 59%. The wearables, the remote patient monitoring is a big boon to nephrology. So this is where the health risk assessment is able to predict of the complications. So this has been a big boon, for the nephrology in terms of integrating digital technologies for the practice. Digital neurology is another field where digital trackers, artificial intelligence, and the virtual reality are making a big change. In fact, my friend at AIMS, a professor of neurology, has set up a telephone helpline, in the last year during COVID. And then she told me that my patients from across the country benefited immensely. It was as good as I used to meet them in my office for follow-up. So I think right from the basics to providing consultation and treatment is getting to the next level. This is where the changes are happening in the practice. Digital obstetric and gynecology, this has been one of the fields, like in fact two specializations, gynecology and urology, have been using robotics, almost 50% of them in the procedures. But what is happening is the digital consultations and the remote patient monitoring is leading to one big change, and that's shared decision making. Giving patients the choices, giving patients the information. As I said, the pregnant mothers, 97% go to the net, 83% end up changing their decisions. So I think technology is a big enabler in the patient and clinician interface, and shared decision making is something that leads to better compliance and better outcomes. Digital oncology. So one of the innovations from India is the virtual tumor board. So what happens in the virtual tumor board, which is developed by the Tata Medical and the other private sector guys, what they do is on the complex procedures, they get to discuss the complex case, find the best solutions for that. Then wearables and virtual reality. So this is effectively used. And also, there is a game called remission. So gaming is used in oncology where the compliance rates go high and actually people understand how the treatment works. So a game is being used in a field like oncology. Game is called remission. You can look up that. So look at the way fields are changing. What used to be totally driven by just medicines, surgeries, is using technology to the next level. We have a pill which is approved, which is for chemotherapy, and I will talk about it later. So this is a digital therapeutics which is being used for oncology, for cancer treatment. It's a whole new way of looking at the specialization, not something that was thought about 5 years ago. Digital ophthalmology. So this is a field where I have been involved for one of my roles, sitting on the bilateral fund of the government of the United States and India. We have over the last decade funded multiple innovations, checking retinopathy using AI, fundus examination. But I'll give you a much larger scale of adoption of technology in India. The Arvind Eye Care System. The Arvind Eye Care System, through 77 centers in 2019, which is before COVID, did 6,89,000 consultations, which is roughly around 3.5 consultations a minute. But the beauty of this entire model of the Arvind Eye Care, if you take teleconsultations out, the model will collapse. Because what happens there is a patient walks into their remote center, a technician will examine, transmit the report to the Coimbatore center or the Madurai center or the other centers. Then they will decide whether they need to go to the main hospital or it can be remotely handled. Same happens with Shankar Netralaya. This is all driven by technology. Digital orthopedics. Now, this is also very interesting, where robotics, 3D simulation, and digital rehab is making a big difference. If you look at this, I'll give you an example about what happened recently. One of my family members actually, had an issue, and I called up my friend in AIMS and asked him that this is the issue. Unfortunately, we cannot go out to consult. What do you suggest? So he examined and said, look up this YouTube, 2 quad exercises. That's it. But I think the specialization in itself is leveraging technology. Now, the major surgeries, they superimpose the models of what would work, what would not, even on the implants, how they could fit it well so that the least complications arise. So this is becoming really big. On the rehab, I'll give you an example. The largest kind of study done with 27,000 hybrid rehab cases in UK led to a result that 92% of the users were satisfied, which is almost as good as you would have face to face. So it's unbelievable acceptance of digital health and the way the changes are happening. So digital pediatrics, this is another big field where I have big hopes. And in fact, in the book I write that if we are able to get those children whom we are treating to use EMRs, right from the vaccination charts to everything, when they grow up as digital natives, they would transform not only other specialties, but I'm sure they would also end up becoming clinicians. They would be the best in the lot as clinicians, as pediatricians and whatever specializations you choose. So digital pediatrics is also one of the fields, where I see the biggest changes happening. So gaming, mobile apps, health risk assessment, everything is getting into it because children cannot express as the younger ones. Technology comes to the rescue in terms of getting the right things to the clinician. Digital psychiatry is one of the major beneficiaries of technology, and which includes the internet-based cognitive behavioral therapy, artificial intelligence, and digital therapeutics. So there are multiple things, and I'll give you an example that there has been a psychiatric patient, and let me tell you, it's tough for a psychiatric patient to be traveled all the way to a metro, because most of the psychiatrists in India, you have 5,000 psychiatrists. They are mostly in super metros. So how do you take a psychiatric patient to super metro, and more so if one is a violent patient? So this digital consultations are a big relief, not just from consultation, but follow, because typically they are on a long medication. They will continue for medication probably for life for some of the chronic patients. So one of the best results we have been seeing is the internet-based cognitive behavioral therapy. AI is coming to big rescue, and also the health apps are gaining more prominence, and the evidence is mounting for support of them that they really help. Digital pulmonology, again, the artificial intelligence, machine learning, and virtual reality. In terms of lung cancer diagnosis, AI is seen to be clinically precise. That's one of the big wins. The smart inhalers with sensors embedded actually interface the patient with reminders with the usage of the medication, the dose reminders, and also follow up with the physician. So I think the technology is getting embedded as we see. Most of these specialities are leveraging upon the soft technologies along with the hard technologies. When I say soft technologies, they are the AIs, the machine learnings, and the hard technologies are your wearables, the virtual reality plus. Now let's get to the other side. So what do people feel? People who are using technologies, the clinicians. So 80% consumers said that wearable technologies make healthcare convenient. For me, it has worked. Absolutely. I know how many steps I take every day, every year at average. I need to maintain that every year. What's my diet? What's my sugar readings? My finger ring tells me what is going on. So I think this is making things better. Also, the daily tasks performed by doctors will eventually move to technology, which is actually happening now. And this is important, though this was pre-COVID. 71% of the millennials would love to have the doctors who use a mobile app. And you don't wait for a time when someone comes to you and says, hey doc, do you use an app? Do you use a patient portal? And you say no. I said, okay, I'll come again. Because this is something that is getting to be understood as a basic plus in a clinical practice. Also, this is another reality. Mobile has emerged as a preferred medium to manage a health condition. 1 out of 2 people use app to manage their condition. But most importantly, 1/3 of the professionals believe that patients who use technology manage their conditions better. And that's proven. There is enough clinical evidence. This is undebatable. So I think those who look at specialization where there is a chronic patient, or even an acute, where you need to be monitoring that, this is something to be done. Now, this is another interesting thing related to cardiology, but let's look at the reality. You use a conventional method to look at a heartbeat, you get 7 attributes with 56% accuracy. Use AI, you get 10,000 attributes with 90% accuracy. No brainer. Why should I be using a conventional thing? And if you tell me as a patient, if you are a doctor, if you tell me that I have 2 options, which one would you like? I'll say one which is 90% accurate. For health, no one would choose to be compromised on 56%. Audio drugs with psychedelic effect are there. This is something that got reported in India, but that's how it is for managing depression and anxiety. I talked about the chemotherapy drug. It was approved in 2019. It's called Proteus. It's a drug for chemotherapy, and it's actually being used. It's available. So what used to be maybe a few years ago, we used to talk in the US about a digital therapeutic will come. 2015, it got approved by US FDA for other things where software, etc. Gradually, it has moved to a line where this drug was approved in 2019, Proteus. Now, let me give you a live demo of what a chronic disease management could be like. This is something that you can see of how things stand today. By the way, this is also old, run by an Indian we should be very proud of. His name is Dr. Anand Iyer, runs WellDoc. This was the first app approved by the US FDA, reimbursed like a drug in the United States. Now it's available all over the world. So this is how it works.
As the prevalence and cost of type 2 diabetes continues to skyrocket, one thing is clear. Traditional treatment regimens don't work alone. People with diabetes not only need to be more connected to their care team, but they also need guidance on how to better self-manage their disease all day, every day. Introducing WellDoc's Blue Star, the first FDA-cleared mobile app for people with type 2 diabetes. Blue Star engages users with a self-guided and highly personalized experience, to the tune of more than 20,000 coaching messages and an average of 13 to 24 in-app actions per user each week. Blue Star serves up this precise coaching at the exact moment a person needs it, on or offline. Most importantly, Blue Star helps people significantly reduce their A1C by an average of 2 points, typically within 3 to 6 months. To correlate this decrease in A1C to cost savings for health plans and employers, WellDoc worked with Truven Health Analytics, and their analysis was staggering. Blue Star was shown to save an average of $254 to $271 per user per month.
So this is what an endocrinologist's dream is, that you want to get your HbA1c down by 2 points in 3 to 6 months, but there's a lot of struggle. Now this app has proven it can, and there is a saving also linked to it. But look at the next level which is reaching now. Earlier, what happened, if I input my sugar and it fluctuates, I go back to my doctor and say, look, you need to look at my insulin dosage. Now this app can do it. So based on my input of the sugar readings, it can give me 3 options. Say, here Rajan, continue with your insulin dose, your diet and your exercise plan, nothing to change. Second option, reduce your insulin by X units, increase exercise by 20 minutes, take this meal, item number 7, on the menu of the restaurant 1 mile from your place. This is something that was never thought outside the realm of a clinician. A US FDA approved will do it. So let's understand that these tools equip you, save your time. You put a patient on a plan that is backed by technology solution like that. But this is available for diabetes, getting for hypertension, and for other diseases. And I think these are the things that are supposed to be available. Now, I think Anand is supposed to be launching this in India too, but it's all over, available all over. But look at how the diabetes management has changed. An app takes care of in the interim when you meet the patient. Phenomenal change. The next one is again something that I saw in the Tumor Medicity in UAE. While their president, Dr. Moridin, took me around to his facility, I stopped by at this robotic pharmacy. And I think told you in the very beginning, the entire ecosystem is changing. So when I say the ecosystem, you need to understand that ecosystem means everything around your medical practice is changing. This is what I saw as robotic pharmacy, and I want you to look at it. So I must thank Dr. Moridin for sending me this video, and you see that even how we dispense medication is changing. But this is not the end of it. Giving another example, the next one is where Amazon acquired this company Pillpack. Very interesting of what it does.
Pillpack is a new kind of pharmacy. We package your medication and deliver it directly to your door. All you have to do is tear and take your next dose. Managing your medication has never been easier. Here's how it works. Each month, we'll sort your meds, including any vitamins and OTCs, into easy-to-open packets. Need other items like inhalers, creams, or testing supplies? We can send those too. We'll work directly with your doctors and insurance to resolve any issues. We'll adjust your medication if your prescriptions change, and we'll automatically handle all of your refills so you never have to worry. If you have questions or need to make an update, our pharmacists are available 24/7.
So just imagine. And why I'm giving you these examples is these are large companies like Amazon. They acquired this company and they operate in India too. So, and as I told you that we have 20 crore senior citizens and they're on multiple medication, at least 85% of them. So we hope that a whole lot of things will change on the practice side, going forward. This is another interesting, solution that comes on primary care. And you look at seeing how primary care is changing.
Start by walking up to one of these iPads to check in. What's cool about this is this shows you your playlist of the day. It shows you what you have to get through. So we take the opportunity of having you here to go ahead and get a whole bunch of information, what we call your baseline of health, so we can start to look towards the future. And so the first thing that you're going to see in your playlist is that a body scanner is kind of the first way that we do that. So why don't we go ahead and hop over and I'll show you how that works. Just go ahead and take your left hand and lie it flat right there, and then you just want to slide 2 fingers into that and push forward. Any two fingers. Okay. Yeah, and just push forward. And so what's cool is just in 45 seconds we get all this information, and then that's channeled straight into the exam room for you and your doctor to go over, but it's also sent down to your that we realized early on, and it's kind of obvious, is that people don't like walking around with their warm pee in their hands, right? So here, after you go ahead and pee in the cup, you just go ahead and toss it right in there, and then this will actually take it automatically into the back of the house to be processed for you. Great. So when you come in, let's say you're more focused on wellness, right? I want to sleep better, exercise more, lose weight. We send you home with one of these sensors. And so what's cool about these is all of them constantly, when you use them, are sending data back to your doctor here. So your doctor can go ahead and keep an eye on your health, not just when you're here, but even when you're gone. Well, Adrian, thank you so much for
So look at how the entire realm, whether you talk about a specialist or you talk about a family medicine or internal medicine person, how things are changing. And this is not rocket science. This is not expensive. This is something that leads to better outcome. Look at countries, which are giving fitness band to their, citizens, saying, hey, keep it. We'll see the data at the back end. But things are changing. Now, let me walk you through the country's ecosystem. We as a country, where are we? I mean, at the end of the day, India also is adopting technology. Since I was one of the persons who pushed for health policy in 2014, and I also ended up playing my part in writing it. And so what did I write on the digital health? As I said, I am a believer of the ecosystem approach. So the header that you see on the digital health is digital health technology ecosystem. So I went on to qualify the specifics of technology, which is typically dismissed like ICT as one word, to say it will have e-health, m-health, cloud, Internet of Things, wearables in the healthcare delivery. We're absolutely clear about it, that India is going to leapfrog in digital health. Also, it talks about extensive deployment of digital tools. As we sit today, I will walk you through the next slide of how far we have gone. We're talking about integrated health information system, federated health information exchange, use of smartphone and tablets for connecting real-time data, and various initiatives on teleconsultation. Now, a lot of people keep telling me, and I've been a policymaker and I keep hearing this, that policies are a piece of paper. You write them or you don't, things don't change. Well, I am not a cynic, but I believe I'm an optimist. I'm a perennial optimist, and I believe that once policies are written, they will be implemented. There could be bureaucratic hurdles, but still they do get implemented. So let's see what's the impact. So this is the government's press release on the 17th of March this year. So we started our e-Sanjeevani, the government's proprietary telemedicine platform, on 13th April 2020 with 220 specialist OPDs and 30 general OPDs. 21 lakh patients have benefited. If I take all the consultations, it's more than 30 lakhs. By the end of next year, it will be operational in all the 155,000 health and wellness centers. The thing that I envision for primary care is to have health and wellness centers which have telemedicine. If you heard our Honorable Prime Minister a week ago, he said, where you are unwell, there we should provide you treatment, implying digital consultations. So all those who join Practo are ahead of time. Government also wishes to provide doorstep treatment. Absolutely clear on the vision, absolutely clear on the policy, and absolutely clear on the implementation. There will be bottlenecks, there will be hurdles, but I bet you India will leapfrog in technology. So when I was talking about the ecosystem from the very beginning, the ecosystem that you see is big tech companies, technologies. There are players who are getting in. There are tremendous innovations that are making healthcare efficient, effective, outcome driven. This government that is pushing for it. I see no reason why people should be still ignoring digital health. No way. This is another thing, that I looked at almost every data available, and my conclusion is a lot of us live in our eminence, ignoring evidence. Hey, look, I've been practicing this for 26 years. This is all bullshit. I don't care about it. You cannot be a conventional practitioner with a digital age patient. That's what is going to happen. So if you have still not made a transition, your time is now. Your time is now to initiate the discussion, at least what you want to do. The another thing, and if it is bold to say, I won't shy to say that the conventional ways of treating a patient are over. You cannot treat the patient in the conventional manner. This is another disruption I would like to see. I mentioned that in the book. So 2018 WHO said gaming behavior was a disorder according to ICD-11, International Classification of Diseases. 2 years later, US FDA approved gaming for ADHD. What a disruption. So a disorder is used for treating a disorder. Now this gives you a sense and direction of where your disruption can happen in your practice. Even 2 years would be too old. There's something new that's in the offing. My assessment of a doctor is that a new age doctor has to be clinical competent, that's a given, but has to be technology proficient too. I believe every doctor will be a digital doctor going forward. There is no ifs, there are no buts. You got to be that. And this is a very interesting thing that you need to consider. I think I dwell in detail. See, earlier what happened is that doctor knew all, and the patient came to him asking for treatment, and the doctor said, okay, this is what you got to do, fine. Now a patient that comes to you has actually, maybe, I'll not say more informed, but definitely more Googled. So what you do is, you share the information and work in coordination to help him take the right choice for the treatment. So doctor's role is becoming that of an intermediary, not a know-all person, which used to be existing earlier. That's a big shift. Every doctor will have to realize that, and will have to use technology system to enable an ecosystem where patient is informed early on, saying, come, meet me, but read this before you come. You can actually check this. I think this is the best insurance for your practice. Use technology. It's not a threat. But if you don't, then it becomes. I'll give you the statistics. A lot of people think that this is new. Actually not. The chairman and CEO of Kaiser Permanente wrote a preview for my book in 2016 on health reforms. Their company, one of the largest insurance in the United States, actually had more digital consults than face-to-face consultations 9 years ago in 2012. That's the reality. It's not because I am saying and I put in the book. Look at the data. I've looked at the data. There is no reason why we will not move that route. Given what government of India is doing, what the entire ecosystem is shaping up, absolutely. the way you define a drug, the way you design a clinician, the way you define a follow-up, all is going to change. I think we need to change before that. So what are the next steps? We talked about technology, we talked about the ecosystem, we talked about the changes that will hit you. So what do you do? If I were a clinician in your place, I would talk to my patients, seek their views, check out my goals. What do I do now? My patients are on the web. Should I start a website? Should I do something? What do I do? Plan a strategy. You want to do it outsourced, you want to do in-house. Sometimes shared resources make sense. Have a transition plan with a backup. It'll be good to have a staggered plan. In fact, in my book, I have dedicated chapters to it. What are the technical requirements? What are the devices you need based on your specialization? How should you have a rollout? What you should be doing as a checklist of what you need to do. So I've gone in detail on the implementation part also in the book. But more importantly, I think besides the book, what I'm doing is rolling out 2 initiatives this August. One is the Digital Health Academy, where we want to provide courses. We're working with companies like Practo and associations of professionals about the Certified Digital Health Professional course, where you learn how to do what, and you look at the theory, technology, and the application of digital health in your practice. And the other initiative is Health Parliament, where we are getting people on board to actually influence the policies that help favor evidence. So one of the things that we do there is work on policy papers, and we're rolling out this in August. And thanks for this opportunity, and I look forward to the questions now. Nilesh, over to you.
Thank you, sir. Thank you for the masterclass. I mean, I wouldn't call it a webinar. This is more of a masterclass for all of us. And I can see from the comments and from the viewership that it's been very well appreciated. There are many questions. Most of them have already been answered by you. Maybe people joined late, like this question on how dentists can use technology, which I've already answered. So I would advise these people to go back to the beginning of the webinar and watch it again. Many of these questions have already been answered. So I'll just pick up the questions which I think are very important and which have not been answered. So the penetration of internet in India right now is close to 45%. But still, I believe that doctors are slightly behind the curve in adoption of technology in their day-to-day practice, whereas patients are very willing to use technology. So how do you see doctors in the coming times pick up technology, and what are the first technologies that doctors should pick up, at least GPs?
Thanks, Nilesh. A very important question. See, when we start a car or when we move out of our house, we don't wait for all signals to turn green, right? If I decide that I'll only step out of my house with the car, when all signals are green, I'll just zip past the road. That's not the way it works. Some are green, some are yellow, some are red. You keep moving. So that's where I said, if you looked at the last slide where I said, work out a strategy. So if you're a general physician, the first thing you need to look at, I need to get patient's data on record. So you start with the basics. That is an electronic health record or the medical record, whatever terminologies you want to use. For me, it's the digital health record. I decided to not use too many the terminologies. It confuses people. So what is digitize the record? The second thing is start looking at a patient portal, whether as an app or as a web, because let people enter the data. You get more control over the medical condition and better treatment once you start moving in a phased manner. Actually, for all levels, I have gone in detail in the book to tell what are the next steps you must do in the next 1 year. But for the general physicians, I see a much bigger role. And I think being on platform like Practo is a very good step, because you are there when people need it. In fact, I would give some statistics, Nilesh, and that is very much from Practo. So during the first wave of COVID, the consultations jumped 250% just for gynecology, and age group was 21 to 60 years. And 50% came from tier 1 and another came for tier 2 and plus cities. So saying that, people, penetration is 45, people don't look at smaller cities. I think this is the data that I looked at. I mean, I am going to look at data and then tell you my response. So when half of your consultations are coming from tier 2 and 2 plus cities, I have no reason to believe that people who are in remote parts don't use, and people who are older don't use it. My evidence says people at the age of 70 are keen to use apps, are keen to use and get information on medical conditions. So I think we have a lot of preconceived notions about the patients. but I know that there was a slack of time. I needed to be very specific and just mention top 2 or 3 things on each specialty. I couldn't even cover every specialty. In fact, in my book, I cover 31 specialties. Every disease condition, right from tuberculosis to cardiology. But I guess the GPs have a much bigger role to play. Look at what the government is doing. I mean, 30 lakh consultation in just less than a year when we are all passing through breathing problems. But I think GPs have a bigger role and we want them to take a frontal role. Otherwise, we will get into secondary prevention rather than primary prevention.
Thank you, sir. In fact, I would like to take this time to request all general practitioners to join Practo, mainly because the patients far outnumber the doctors right now. And a lot of consultations for GPs are right now going unscheduled because we don't have enough GPs on our platform. So please, any GPs in the audience, please do join Practo. All patients across India are needing you. Okay, so another question on GPs again. What do you suggest are the common variables a patient of a GP should be using?
So the first thing is, that let's understand that the vitals, most of the vitals and health risk assessment can be done based on your basic parameters. Your height, your weight, your temperature, which is today something that one needs to do. The other thing, I think the smart bands are available now at 1,000 rupees, which track maybe 5-6 key parameters. You don't have to go for a high-end ring, to track, but I think you can do that. So I would say that, work with pharmacies. We have always ignored the 7 lakh pharmacy networks in the country. Let them have, why should, every family have, they can have a weighing machine, they can have a BP monitor, they can have a sugar monitor, and they can have all the basic things in place. Now our very own friend, has Divox system that takes 41 metrics on his Divox machine. So why not have those things adopted by the local communities, and GPs are approached in time. Don't approach the GP quite late. And I think we have this inherent psychology. We don't fear preventive checks. What we fear is a fear of a negative outcome. That's a fear psychosis keeps us out from prevention, and that takes many people only on the road of chronic diseases. So I think one of the things we are doing also, where I think Nilesh, I will talk to you, and Shashank, working with Practo doctors. I think this is one of the biggest platforms that we have in the world, is to work with your doctors to come out with guidelines that we are making, that people should know at what age they need to do the checkup. They should be going to a GP on their own as well. It should not be a pull or a push. It should be a regular part of the routine. So I think it is not a question for GPs only. It's a question from population health perspective. And I think at Health Parliament, we are doing those guidelines. Nilesh, I'll talk to you about that. I think it needs a multifaceted response from the government, from the organizations like ours, from the doctors of your community, and also from the patients to be aware about their health. You should know your common symptoms and approach a doctor before it's too late, which is something I think Indians are used to do.
So I would suggest we are touching on these topics just superficially in this webinar, but there's a link to Professor Gupta's book where he talks about all these things in detail. The link is in the chat. Please click on the link. There's a discount coupon also. You can use the discount coupon to get a special discount, and you can read the book with all the details over there. So, sir, next question is something I know which is very close to your heart, and you have been into for a long, long time. What is the possible digital implementation strategy for public healthcare in India?
So, Nilesh, for me, the way I look at the transition, and I must say that it has been my exposure, of working across geographies and even with WHO on the digital health guidelines, is I think we'll have to move a step beyond public health, which is population health. We need to look at populations. We need to look at them as a whole, as a unit, and then you embed the GP session. You'll be surprised, and this is, I think, something I could share with you. When I got the draft of the health policy to be vetted and finalized, it didn't have 3 things: SDGs, Mission Indradhanush, and GP. I said, how on earth we will have a healthcare system in India without these 3? Indradhanush, one of the most successful programs. SDG, we are a signatory, we cannot ignore it. And without having GPs given a prominent role, how do I build a health policy? So I think I'm very clear that these people have a role, but on a role for populations. In the government system also, we have prioritized, and we are looking at that. We need to work on the technology part platform that the government is building. embed this on the guidelines that we create for various population groups, because they are the actual gatekeepers if you want to keep population healthy. We cannot afford a budget like United States. I think with COVID, we are already behind by at least a decade. GPs will have a frontal role in managing health. And plus, they should be given some supplementary training to handle beyond the routine. That is something that I would vote for.
Right, sir. In fact, I believe the government has raised the public expenditure on public health to 2% now, just a few days back. So that's a really good news for all of us. On the same way, sir, you mentioned that for GPs or any doctors to first start getting into this avenue, the first thing is to start collecting data. So you start with a digital health record. So, sir, do you really think that the EHRs or digital health records will become compulsory in India?
See, some things don't require regulation. It is your commitment to the patient. Now, let me give you this example. Nilesh, you didn't ask me to make a PowerPoint. You didn't ask me to spend or to create this video, give live demo to people about what I'm going to talk about. I think this is our responsibility. If I'm concerned about my patients whom I treat, I would like to know them in entirety rather than their symptoms. And that cannot happen without having a digital health record. So I think this is something which is the professional code of ethics for any clinician. This is not something that is mandated or not. I am a believer that, and I've been, a policymaker, and I still lead that at many points. I think making it mandatory is offending someone who should be responsible in his own mind. Why should everything be mandatory? Yes, there is a system. Government is saying that we will do digital consult. 21 lakh people have used. That means the data has been fed into eSanjeevani. You will eventually feed. I think this should be a part of your self-regulation and self-adoption. Right. That's a much bigger responsibility. And with platforms like yours, it becomes easy. Major hospitals are going to do, but let me also, because you have asked this important question, I would say this has been my biggest concern. A lot of people, and have talked about this, AI will change. Now, AI works on clinical data, right? We keep talking about big data. Basic data is not in place. So if we are looking at better outcomes, we are looking at big data, let's create the basic data. Let's work on it. EHRs are not expensive. Let's start with the basics. Let's get our patients to give us the basic data and start treating them. I think this is something that should start from the clinicians on. Government mandates, go on strike. So it defeats the purpose of what government wants to do. So but much rather let people, it's a grounds up movement. It's a ground up movement. I think people have to say that, if you're a patient coming to me, come with these 3 things, fill it and come to me. Doctors are doing it. Individual doctors are doing it in India. And I know them in smaller cities. So I think no reason why people should not be starting to do it.
So these answers have started a trickle in of one particular question for us. 3 or 4 people ask this one after the other. What are the legal implications of telemedicine? Are there any medical legal aspects? People are scared of that. What do you think about that?
So Nilesh, another side, I'll tell you that, 1st June in Health Parliament, we are releasing the tattoo guidelines. In India, there are no guidelines for body piercing. And it's a big thing with youth population being 50%. So one of the thought came that why don't we take to Balram and ask him in ICMR that, just adopt this. But my thought was that everything government regulates, what goes? Wherever you have regulation, only 2 things happen. Flouting by the rules and exploitation by the enforcers. Digital consults came in. There will be, let me tell you, when you do digital consults, maybe 4 out of million will go and do nasty things. But that is where well-minded people, even judiciary, will take a view which is based on the reality. If you don't have malified intent, why you should be worried? Why should be worried? I think for the fear of having something, we don't stop doing it. You don't stop flying because there's fear of a crash. So let's be clear. So if fear is driving and stopping us, all the more reason for us to clear this and get doing it. I think digital consults have been the way for the last 2 years. We haven't seen that, and we have seen in the original practice 5 crores were fined by to a family in Calcutta, by a family in Calcutta. So those aberrations should not stop the caregivers. I think there will be issues. We'll face them as they come, but I think government is very clear that we need to take it to mass scale. Very clear when PM said, "Jahan problem hai, wahin pe humko ilaj karna," implying that digital consult has to be there. people should not have to move. I will not be surprised if we one day disband those primary centers and convert them into mobile vans. So technology moves faster and it leaves a footprint. If I am not doing wrong, why should I be worried? There will be a digital footprint of everything I do. So I think fear is there. Let's accept it, but let's not stop from the mass adoption of what's going to happen. It's not going to stop us. Every time there was a fear, people said when you add the tube light industry, candle industry will go extinct. People revolted. Nothing happened. We all use that. Computers came. People said loss of jobs. We know what has happened. So I think fear is always there when there is a big change. This is a big change. So obviously, the resistance to change will creep in. And there will be some people on the other side strongly opposing it. Doesn't matter. In the government, I had the same thing, people coming and opposing, don't do this digital thing. Nothing doing. We had to do it. We've done it. At least when COVID came, we were all ready with the things. We didn't have to do it. Everything was ready. So let's be very clear. Technology time will wait for none.
True, sir. And it's not as if we are walking in the dark. We already have telemedicine guidelines which came out last year.
Yes.
So we know what is allowed, what is not allowed. We have a broad framework and it's only going to expand from there.
That's true.
So we do have guidelines. It's not totally out in the dark.
It's not a gray area now anymore. That's true.
It's not a gray area anymore. So I think one particular thing that we haven't touched upon was use of technology in physiotherapy. There are 2 or 3 questions around physiotherapy.
Wow.
Could you give us some idea?
Oh yes, there is a detailed section on that. In fact, I referred in my rehab in the orthopedics that the largest study was conducted with 28,000 users on hybrid physiotherapy. 92% people felt very satisfied with it. On the digital physiotherapy, what happens? You actually see the patient's environment too. When a patient comes to you in your lab or in your clinic, you actually don't see that. But when you're seeing someone, I'm doing a consult, I can actually see your background and say, hey, look, Nilesh, this is not going to be working. This is going to probably harm you. Just remove. So digital physiotherapy with sensors and all, I think is doing much better. And the effectiveness satisfaction is beyond 92%. So this is one field. This is definitely technology driven. With sensors and kinetics, this is going to be phenomenal.
True, sir. I totally agree. Some real great work will be done with in these fields, at least physiotherapy, ophthalmology, neurology. Some great work ahead. Sir, okay, now we are going to go on the other side of the fence. What are the effects of telemedicine on healthcare? Do you think it increases strain, decreases strain? Do you think there would be any effects on the healthcare workers themselves?
So, this is a complicated question with a simple answer. I don't know how many people, but I think you had 1250 registrations. I have not stepped out of my house. Using technology, I have addressed them. Hopefully, we are talking to all of them. If it was in a room, we would have spent maybe a couple of lakh rupees. People have to fly in or travel. Technology, I will give you your own example of Practo. So 30% of your consultations happen in the odd hours.
Yes.
Whom does it provide relief? Do you think you as a doctor would not be happy if your patient connects to you when he needs you? So do you think the patient will not be happy if he gets the right thing from you and he is back into normal? Anxiety has killed more people than the real ailment. In the last couple of days, I have having patients saying, sir, very critical condition, can you help? And I go back and call my friend Dr. Bolanath and say, Dr. Bolanath, here is a patient going to talk to you, please help him. Now that guy is in Bhatinda, I am in Bombay, patient is in Delhi. Yes, there are always pluses, there are always minuses. There is, as I said, you have to set up a system. That's why I talked about in the book on putting a strategy for digital health. The convenience is given. So someone calls me on phone, I can always have a rider saying, please send me an email, I'll respond back. So what happens is that with email, when you can respond back, or someone from your office can respond back. We will also learn with technology, but I think it will do more good than harm in the clinical practice. We will all learn in the process. In fact, clinicians will be the best and the biggest learners. You will end up getting patients from outside of your area. Which is a clinician who doesn't want to give relief and serve a patient from outside? Actually, everyone would like to do. So I think this is a big thing, and I've actually done extensive case studies when it's a 600-pager book. So you can understand that every aspect of the varies and the questions that you're asking is been documented with data. So the clinicians are the happiest guys with technology. Talk of any country, because it streamlines a lot of things for them. A lot of things that I don't want to do, I can stop. A lot of things that I wanted to do had constraints. Technology takes them constraints off. I put a line there. Artificial intelligence will remove artificial barriers. I think that is what it's the end of all the things that we see.
Right, sir. Right. So for people asking about the book, the link is in the chat. Please scroll up, go to the link, find the discount coupon code, and go buy the book. I can't keep repeating it, so please do that. There are some questions on what app to use, what EHR to use. I will not bother you with those because those are very, very specific questions. We will not answer those questions.
Yeah, what I have done in the book, this is first time. Normally, I've written 5 books, but I stopped short of putting, the commercial products there. But this book, because see, it is meant for application. So I've gone to talk about the apps that are available, solutions which are available for each specialty. So people can choose, they pick. Also towards the end, I give guidelines of what you should be doing to choose, what you should be doing to figure out which are the apps. So I think this book is more from the application of clinicians from their specialty point of view. So I think those questions are answered in the book. I would not go to name them, but yes, they're all mentioned in the book.
Right, sir. So I think I've taken most of the important questions over here. One question maybe you would like to answer. There are some doctors who would like to make a career in digital health.
I think
a whole career in digital health. What is your advice for them?
I think this is something that I would advise every doctor. That's what I sent in the last slide, is that every doctor is expected to be a digital doctor. And yes, some of you, like, you have been a big contributor to digital health. And today you are amplifying your work with Practo. So I think some doctors will have to take thought leadership and implementation leadership. That's where, we are coming out this program for every doctor. I think it's for all clinicians, and this is a global program we'll be launching in August. Nilesh, I'll talk to you about it later. But I think, yes, I would be very happy to see more and more doctors, nurses, pharmacists, physiotherapists taking to digital health and serving patients better.
Right, sir. I assure you on behalf of Practo, we would be more than happy to collaborate with you to take this program forward. We'll definitely talk about it, sir. I think I've taken most of the important questions. I would like to thank all the participants. And so we will thank you, sir, for your time. It's been a great masterclass. Thank you once again. Thank you all the participants. Thank you. Bye.
Thank you, Nilesh. It was a pleasure having you and talking to you and your doctors. Thank you.
Totally our pleasure, sir. Totally our pleasure. Thank you. Bye.